People with antisocial personality disorder, previously known as the psychopath or the sociopath, lack empathy, display a pattern of disregard for rules, and frequently violate the rights of others. They may be excessively opinionated, self-assured, and cocky. They may display superficial charm and charisma and are very clever with their words. Many fail to conform to social and legal norms. Often, they display deceitfulness and repeatedly lie to others for their own personal gain or pleasure. They are impulsive and they fail to plan their actions. For instance, they may have a sudden change in jobs, their residence, and their relationships. They are often irritable and can be either verbally or physically aggressive. People with antisocial personality disorder have reckless disregard for their own safety and the safety of others. Some of their behaviors include reckless driving or driving while intoxicated, sexual risky behavior, and substance abuse. They may have multiple sexual partners and may never sustain monogamous relationships. Like many leaders of organized crime, they often spend many years in the legal system. They have higher rates of early death compared to the general population due to violent behavior or accidents. They are consistently irresponsible with work, their financial obligations, such as abandonment of a job, repeated absences at work, failure to pay their debts or child support. They lack remorse by their behaviors and are either indifferent or they rationalize harming, mistreating, and stealing from others. Many will blame the victim for being foolish or helpless instead of themselves. If patterns of violating the rights of others typically happens, it does so in the beginning of childhood or early adolescence and continues into adulthood. It is common to exist with other mental health disorders, such as anxiety, depression, and substance abuse. They may also have existing borderline personality disorder or narcissistic personality disorder or both. They are genetic and environmental factors that do contribute to this disorder. For instance, this disorder is more common in first-degree relatives in comparison to the general population. Most people with personality disorders in general do not see their behaviors as a problem, but tend to point their fingers at others when they don't either cooperate with them or they don't like their behaviors and others tend to set boundaries with them. As a result of their behavior, they often burn their bridges with others in their relationships. Because they don't see their behavior as a problem, it is very unlikely that they would pursue mental health treatment. Often, they will find their way indirectly into the mental health system due to some secondary depression or anxiety, or maybe some substance abuse issues, or even due to frustration of multiple failed relationships. Antisocial behavior is difficult, but not impossible to treat. If people with antisocial personality disorder are willing to be open to understanding more about themselves and willing to change some of their behavioral patterns, they can improve their own lives as well as the lives of others around them. For more information about mental health disorders, please like and subscribe to this video so that I can continue to share more content with you. Thank you so much for watching. Take care.